Do you have breast implants, but you feel that they're too small? Well, it is not usually all that difficult to enlarge if you're interested. So let's talk about what your options are if you have breast implants and you want them to be larger. Well, it really comes down to is it depends on what you currently have right now. And so the procedure itself can be very simple or it can be quite extensive. So by meaning simple, we can do a simple implant exchange, and this can occur if you've got a smooth-walled implant and the pocket that's in is sufficient size that we can make it bigger. Okay, so if you've got implants that are smooth-walled, whether they're saline or silicone, and the implants are soft, and when you kind of massage your breast, the implants move around in that pocket, then that means there's usually extra space in that pocket, and we can literally take the implant out, put a new one in, go through, let's say, your old scar or a new scar underneath the breast, take the old implant out, put a new one in, and basically stitch you up. That could be a very, very simple surgery, pretty similar to when we downsize somebody. And so if that's the case, if you've got breasts that are soft, they move around. If you push them up, they go up. If you push them to the side, they move around a little bit and they feel natural, then it's definitely possible that we can increase your size a certain amount without having to do anything more than just switch the implants out. However, if you've got other issues, if you've got a textured implant, or if there's not enough size there, then we have to do something more. Okay, so the idea behind a textured implant is a textured implant has a sandpapery surface, and that sandpapery surface is made to stick to the surrounding scar tissue. And because of that, usually the scar tissue around a textured implant is adhered to the implant, and the pocket that the implant's in is the same shape as the actual implant. So if you take that implant out and you want to go bigger, you can't because the pockets is the size of the implant that's too small for you. The other situation is when there's just plain not enough size. So if you've got a smooth implant and the pocket size, is still bigger than the implant, but you want to go really big, well, there may not be enough space in that pocket to accommodate the size that you want. And in either of these cases, whether you have a textured implant or not enough pocket space, then what we need to do is called a capsulectomy or a neopectoral pocket with the implant exchange. And what this means is we need to either open up remove all the scar tissue around the implant to make a new pocket, or we just make a new pocket above or below the old one. And so this is a much more extensive operation. You go from about a 45-minute operation with the implant exchange to probably about a 2 to 2.5 hour surgery when you do the other ones. Okay, and so typically if you do a capsulectomy or a neopectoral pocket, switch out for a new implant, we have to put drains in the breasts. The drains stay in for anywhere from 3 to 6 days. You come back to get those drains out, working out for about 3 weeks, and people may take a few pain pills afterwards as well. So it's a very different thing depending on what you have. And very important is if you're going to come in and you want to change the size of your implants, bring your old records with you. Okay, they are super, super helpful at the time of the consultation, because if you come in, you say, Dr. Youn, I've got breast implants, they're too small, I want to go bigger. My first question to you is going to be, what size do you have? And can you show me, proof that this is your size? Because then we can talk about what size to go to. But if you don't have your implant information, then I have no idea what you have, and it makes my job much harder, and consequently we'll have to have you come back with those records anyway. And so to save yourself the time and the effort of 2 visits, just bring it with you and let's go over all of it at the time of the face-to-face consultation. So a simple implant exchange, the surgery takes maybe half hour, 45 minutes. A general anesthetic, we switch the implants out either through your existing incision or you make a new one underneath the breast. No drainage tubes, no pain pills typically after surgery. You'll see your size difference right away. There's usually minimal swelling. Like any surgery, there are risks. Risks typically are bleeding and infection. We always start with that, although very low risk with this surgery. There's also a risk of capsular contracture, which is excess scarring. So anytime you put a new implant into the body may react differently to that implant, and that could cause excess scar tissue to build up around that implant. I don't have control over that. That's a possibility, but if your breasts are nice and soft without evidence of excess scar tissue for your before, then it's most likely that they'll stay that way afterwards. But you never know. And we go over other types of potential rare complications at the time of your preoperative visit. This is contrasted then to the capsulectomy with the implant exchange, where we either remove the scar tissue to make the new pocket or make a new pocket above the existing one. That does lengthen the operation to about 2 to 2.5 hours. Once again, a general anesthetic, and you do have a drainage tube afterwards for about 6 days or so, anywhere from 3 to 6 days. Recovery usually is not difficult, a little bit harder than the straightforward exchange just because of the cutting involved. Most people, if you take pain pills, just a couple of days. Probably want to take a week to 2 weeks off recovery with this surgery. With the other surgery, you may only need to take a few days off depending on the type of job you have. And the risks are fairly similar, although you do have a higher risk of bleeding just because there's more surgery with this. There's risk of infection, which is fairly low, and definitely risk of the capsular contracture, once again, because anytime you put a new implant in the body may react differently to it. And there's more information on capsulectomy with implant exchange if you go to the section for capsulectomy or my breast implants are too hard. And I'll go into that in much more detail at the time of the capsulectomy, in the capsulectomy section. So if you feel your breast implants are too small, it can be a very simple fix where we can switch them out for a new pair, but they have to be smooth implants in a pocket that's big enough to accommodate the new implant. However, if you have textured implants or you've got you want to go so big that that pocket's not big enough to accommodate the new implant, then we got to take more extensive measures to open the pocket up larger or make a new pocket to accommodate this bigger implant. And that is a bit more surgery with a bit more downtime and risk. So I hope this has been helpful for you. Thank you for watching. I'm happy to see you in a face-to-face consultation. Make sure you bring your records with you, though, and your implant information so we can give you as much information as possible during a face-to-face visit. Thank you for watching.